All right. So thank you so much for having me. It's a pleasure to be here. I've packed a lot in this presentation, so I'll go over some things with some depth and some things with some speed. And I want to start with a preamble, as Laura suggested, sustainability and scale. I'd like to provoke you a little bit on this, and then talk a little bit about definitional issues about sustainability. As you'll see, I'm not passionate about conceptual and definitional discussions about sustainability because I kind of feel like we did that 20 years, but apparently it's still happening, so I need to touch on it. And then especially as it relates to evaluation, which becomes more serious. And then I'd like to focus most of it on how do we practically advance sustainability. Along the ways, there'll be references to evaluation because you really can't advance something without knowing if it's advancing. But I'm not going to spend a lot of time on evaluation. I spoke about that at the evaluation summit of USAID. And I believe there's going to be a recording. So if you're not sick and tired after 30 minutes, there's more to come. So let's talk about sustainability and scale. Yes, I do like to address complexity, but I started as a clinician, and that's the last time I heard Dr. Eric Sarriot so many times in a row, is when I was a clinician. And as a clinician, it does kind of matter what the impact is on your patient. It's not all concepts and proposals and frameworks. So I like to try to bring it down to things that are simple to just try to understand it. So let's imagine you're trying to push an innovation, a kind of intervention, and I don't care what it is. It's exclusive breastfeeding, it's kangaroo mother care, it's emergency obstetric care. I really don't care here for the sake of the exercise. And, here's our standard 2x2 table, and we're going to see if it's scaled or not scaled, sustained or not sustained. Well, if it's not scaled and not sustained, I think we'd agree that's a failure. Right? I don't know. You could try to make a point for it, but I don't see it. So, scaling and sustaining go together here. It's a failure. If it's sustained and not scaled, it might be a great local initiative. It might be a fantastic, valuable neighborhood initiative, even a context that's very particular. You may be in some place in northern Ghana and really the Ghana health services don't get you, and you establish something and you make it work and you don't want it to scale. That's fine. But as far as we are concerned, as a community of practice, maybe that's not our bread and butter. It's not, we don't want to diss it, but it's not a bread and butter. Now, if it's scaled and not sustained, I don't think that's what you guys are about as a community of practice. I was reviewing, we've had 17 years of saving newborn lives at Save the Children, and there's a lot of evaluations that are coming up and documentation. And it was interesting for me to read it, and it's all, we use the benchmark to scale model, which I think, Jim, you worked on, or somebody, anyway. So it's all oriented towards scale. And then I looked at it, and all the kind of threats in the final evaluation were all threats to sustainability. So there's no real meaningful scale up in that sense without sustainability. So what you really want is sustainability at scale. And I would give an example. ICCM in Rwanda was a good example. And fortuitously, the same publication published a publication probably 3-4 years ago, a publication by the Ministry of Health on how they had scaled up ICCM in Rwanda. And we published a paper on the sustainability of ICCM in Rwanda. There was some co-authorship, although the government colleagues kind of pulled out because we touched on some political issues. But the two papers came at the same time, and you can look at these two papers. One is a scale-up framework. The other one is a sustainability. And we're basically telling the two stories from two different lenses, the same story from two different lenses. So I do believe, I'm making a provocative statement, the suggestion below. I made it up yesterday, so I'm not sure it has stood the test of time. But I think that 100 years ago, we knew there was electricity, and we knew that there was magnetism. Magnetism allows you to have fridge magnets, and electricity kind of powers us here. And there are two different things. You're not going to plug your magnet into a plug in the wall. There are two different things. Yet we know now electromagnetism, and we wouldn't have relativity without it, that it's one underlying law. I believe that systems change, systems behaviors is the underlying law underneath sustainability and scale. And if you start reading papers with that question mark, you will find that it becomes harder and harder to see the two are distinct. If you read David Chambers' excellent paper, it's referenced in the slides later on the dynamic sustainability framework. I know a little bit of your work through the ExpandNet model, and it's very hard not to see the similarities. If you look at Lydia Pena and David Peters' paper about scale up, through a complex adaptive lens, I read it and I thought, well, they're speaking about the same thing. So a provocation for you to go further. And now I've spent way more time than I wanted on this. What is sustainability and do we care? So there's a lot of definitions of sustainability. And I want to start before the definition by a scary slide. So here's my scary slide. We were trying to look at the sustainability of a community health program in urban areas of Bangladesh. It's been published, fairly well documented, and that was a map we tried to draw of how we were going to look at sustainability, who influenced whom, and what it was going to be. And that's just a small urban health project. If you're starting to look at things at scale, what happens at scale is that you guys know that more is different. You have more parties, you have more different types of parties, you have more different types of interaction, hence you have more complexity. And so your definition of sustainability is going to have to take into account the complexity of the system. But basically the definition that the OCDE takes and that we follow is the continuation of a benefit, a public good, a benefit, health outcome, or maybe it's a proxy like immunization coverage. But basically, we're looking at some public good continuing beyond a phase of external support. I would say it's external support or societal shifts, because international development is not here to stay forever. But governments will have to deal with the same sustainability questions as we have. So this is a convoluted definition that we came up with the sustainability framework. I'm not claiming it's any good, but it's very useful when I speak to my therapist to explain how messed up I am. But basically, it tried to go into the weed of, at the time we were looking at child survival. There's some important elements to focus on the outcomes. And I'm glad to hear that this kind of community of practice is that other definitions, financial viability, organizational capacity, policy alignment, so many things that contribute to sustainability, or that sustainability of subcomponents of the sustainability of benefits, all of a sudden start to fit. And so you should never, ever let anybody talk to you about sustainability without sustainability of what? Otherwise, you're just going to waste your time, unless you're having a good drink with it, and then that's fine. And then it places the contribution of project in a different place. I think you guys have articulated that for Scale Up. And then there's other, benefits of that. Should we care? Here's a paper I wrote with Jim Rika and Eric Swedberg at SAVE some years ago. And basically, we took a real-life experience, a real case study of SAVE Guinea, and we extrapolated what we had from the data. So it's a modeling exercise to say what would happen if you took two different scenarios for investments over phases of projects. What would happen to the impact? And we basically proposed that based on this model, you could multiply the impact by more than 3 times, and we had the sensitivity analysis. By the way, you can read this paper and look at it as a suggestion for how to scale up as well. We didn't do then, but I didn't come up with the electromagnetic reference of 3 slides before. But all this to say that sustainability is about impact, and we have huge loss opportunities because we have huge shortcomings in the sustainability of what we're doing. Can we quantify it? That's just a rapid plug for a recent paper where we created a Sustainment Index. I'll explain the language of sustainment versus sustainability, Jim referred to in another slide. But basically, we now have a metric for quantifying how much an indicator was sustained from a period, project period, to another period after the project ends or after the funding transitions. Anyways, there's a very simple measure. It's not rocket science. That's why we came up with it. But this measure exists, and I was kind of excited that some people are looking at it to do research with it. And so that's my small contribution to the quantitative field. So it can be quantified, and I hope we're going to move forward towards quantifying as opposed to saying yes, no. Some sustainability questions are yes, no, but they're not the most fascinating in the world. All right. My premise is that we don't always take it seriously, hence the title of my presentation. My premise, I say it when I have a drink and sometimes sober, that 90% of what's written in proposals and sometimes final evaluations about sustainability is just rhetoric. And I have a slide in the notes that I want to present about some language you shouldn't use, and we wrote a blog about it, about ensure sustainability. You should have, when you open a proposal or a call for proposal, you should have an automated system. You can use artificial intelligence, and if there's the word ensure and sustainability less than 2 sentences away, you can skip that paragraph. It's entire baloney. No, because who among you can ensure the sustainability of, well, your job? Or can you ensure the sustainability of your project or institution? This is rhetorical language, which is the bread and butter of proposals, but this does not advance science. So we need to become more critical, but we're not always. Also, as we know, sustainability scales, these are complex issues. It's very hard to put a one single quantifiable set of indicators. I will make the case that I don't believe we'll ever find 10 indicators for sustainability. And so it's difficult. It's hard for us to wrestle with that. It's hard for the donors. It's hard for the implementers. It's hard for the evaluators. That is the state at which we are. This is a problem that's a tough nut to crack. And so that gives us license in this town to write nonsense. So we need to move away from nonsense. So here's a little bit of definitional issues for sustainability, for evaluation. And so the basic premise of sustainability in our context is that you have some project you're implementing, and at some point that project ends, or that funding ends, something happens, and then something needs to happen after that red box, and you want to know if the outcomes, the benefit, the public good continues to improve, or at least is maintained. That's a basic premise under which we're operating if we're in, development assistance. Well, this is a language clarification, but it's really useful, is to say, when you're looking before the end, or even at the end, you're looking ahead. You're trying to predict the future. You say, is there an ability to sustain? And if you're at the end, you're looking back. And David Chambers proposes that we use the word sustainment for that. I think it's a great clarification. So I tend to use it. I don't know why the slides are going all by themselves. But anyways, I must know that I'm going to run out of time. All right. No, I think I'm in pretty good shape. Where are we at? Oh. All right. All right. We're in good shape. Okay. So I'm sorry if it's a little bit of a, I hope we'll have a good discussion. So we're going to talk a little bit about advancing sustainability, how to make it happen. So here are some, 3 recent papers that have been done on the topic. I mean, recent, not all of them very recent, but and they're good. They're good papers. On the bottom left, you have a paper that kind of goes around and does what I kind of did 20 years ago, is take a mic and go see people and say, what do you think sustainability is? When do you know that sustainability, can you wear it after Labor Day? Questions like this. And so here's a list of contributing factors, about sustainability. Now, the beauty of that kind of study, and I mean no disregard for the author of that study, and there's actually some very good stuff in it. But that study can be repeated. The number of variables for sustainability is unending. You cannot find an end to the number of variables. So capacity building is a determinant of sustainability. What's in capacity building? You can go on and on and on. It's very hard. Play that game. When you go to the bar tonight, try to find one variable in your programs that does not affect sustainability. And if somebody debunks that it has nothing to do with sustainability, you drink a glass. It's a fun evening. But there's always quality affects sustainability. Money affects sustainability. Leadership, governance. I mean, name something that doesn't affect sustainability. Great drinking game. So that was interesting. I mean, we've had a lot of these studies, and they're starting to tell us the same story. And so I hope that our different models try to do that. Top left is a study by Beatrice Rogers. Fantastic study. That's really some of the best empirical work I have seen on sustainability. This was in the food security sector, and it's really worth looking at, from a methodological standpoint and from an analytical standpoint. I'm just giving you her three conclusions. Is that the critical factors are resources, technical and management capacity, and three, motivation. But how do you package this then moving forward? But also what it tells you here, and that's part of our model, is that you have a mix of things that could be objective, very tangible issues. I mean, capacity can be subjective, but capacity can be also very objective, measurable. Resources tend to be very quantifiable, although some resources are not exactly. But motivation, you're going into the realm of ownership and things like this. David Chambers has 7 tenets for the dynamic sustainability framework. His work was more theoretical. It was a conceptualization, which I think has a lot of echoes for the way, you guys have been able to kind of map out what it would take to get to scale. And I, being ignorant of both, I find that they're very similar. You guys being expert in one would find 20 things that do not apply. But it's interesting. It basically, the premise of his paper is the centrality of fit of the intervention in the system that's evolving. And both the intervention and the systems are evolving. And there's been a recent paper that actually tries to operationalize that model to study sustainability. And it's in the additional slides references. So it's quite interesting. But this is the issue of fitness. So I'm going to speak largely about the way we've conceptualized it and operationalized it through something we call the sustainability framework. Is it better than any of these models? Of course, otherwise I wouldn't be here. But seriously, no. We're definitely in a case where you've heard this many times, all models are wrong, some are useful. And there's not going to be a model for sustainability. We were dealing at the time, we're looking at child survival. We were working with a large USAID portfolio of child survival grants. And I think we came up with something pretty good, and that seems to have worked and stood the test of time. So I'm going to try to focus on the things that would be applicable to other questions. But the future for me, I'll give you my opinion, the future is not going to be in discussing sustainability. It's going to be in saying, let's talk about sustainability of adaptive community health system. Let's talk about the sustainability of referral systems in geographically challenged environments. Let's talk about the sustainability of response to emergencies and trying to build the resilience capacity. The questions have to become specific. You wouldn't get funded by the NIH to say, we're going to do a study on cancer. It's, yes, what? You'd have to be a tiny bit more specific. So I think for sustainability, we're there, and we're going to run in circles if we stay conceptual. So here's how we think about it, looking forward, and we've tried to apply it, and that's part of what we've documented in some projects. So you've got my 4 little boxes, right? You've got a project, it ends, then something needs to happen, a miracle needs to happen, and then you want some outcomes to be maintained. But you see at the end of the left end of the slide, you've got your project monitoring and evaluation and your little project manager. It's a guy because of clip art, you know what I mean? And that project manager has a high burden of responsibility, a lot of emergencies to handle. And he's convened a little table of blue people. I'm not an artist, I do what I can. And these blue people are your local stakeholders. And so we know we need to involve stakeholders. We need to discuss with them. We do this formative research. But basically, the loop of accountability of learning is this first loop from the implementation to the end during the project. It's the focus, the boundary of the system is the project. That's how we operate. We have contracts, we have results framework, we have budgets, and we can't say we did that because it was good for the local system, but we didn't talk to the AOR or our grant agreement or whatever. So that's what we do. And then the part that's critical to sustainability is what happens afterwards. And so this little stakeholder table needs to become a lot bigger, and there needs to be a lot more learning and adapting while you're implementing, but with a view of what's going to happen afterwards, because it's afterwards that matters. So that means that you've had a shift, and that is the most difficult thing to think about if you're planning for sustainability, if you're a donor challenged about sustainability on the, journey to self-reliance, lingo, or if you're an evaluator, is that you have had a shift in the boundaries of the system. And that changes everything. So that's probably the only important slide of my presentation, is that this shift from the, top left circle to the broader circles. And that's the challenge we are. I would say, from my distant observation, that you guys have, I'm saying you guys because you're a community of practice, and, Jim's been educating me about ExpandNet and stuff for some years, is that I think you've tried to articulate some modalities for managing that shift from project to larger system. And I think that's something that we probably haven't done very well. We've identified it as a problem, but I don't think we've proposed how to do it, or we've proposed it in a way that's been very challenging for people to have. Last little things, there are storms and lightning, and if you operate in a world where you expect that some things will go wrong, then now you're talking about not just sustainability, but resilience. But that's a segue, no added cost. So it's very important at the beginning to get started. In the projects we've talked about, Bangladesh, Guinea, others, is how do you kind of get on these steps towards sustainability? And I think this little visual has stood a little bit with time. It's like you need to have a definition that's on the right. What is the common good being pursued? You need to have a definition of something that is a public good. And it can't be sustainability, just like capacity. It can't be in a void. But on top right, who needs to sit at the table to define and pursue the common good? And we tend to think very strongly about the technical constituencies, and those are very important. But actually, especially at scale, you start to bump into externalities. If this country is an example, is that you can't scale up universal health coverage without addressing political, social, societal, educational issues. So this is true everywhere. So we need to find that balance, and there's no magic formula to know. So in proposals, we have a magic formula. We say all stakeholders. All is well that will be well. We like to use big words like this. Of course, you can never invite all stakeholders. There's not enough room. But so we need to get a little bit better at saying which stakeholders, when, and how. But that's the intention. That's the ideal, right? And then we need to start defining things. So I think that's been kind of important. And I think this happens, and it needs to happen over time. So we used to frame this, don't even try to read that thing, but when we started with a sustainability framework, we had to come up with how do you do it? So this was a theory of how you do it, and I still think it's very valid. I could still speak for 30 minutes about why we developed it, and it tries to articulate this definition of the system, this future-looking definition of scenarios and vision, etc. In reality, you're never quite able to implement starting from one, because you always come into a situation and you're already at step 2 or 3 or 4, or people are doing a midterm evaluation and they called you and they said, could we look at sustainability? Or they call you, the day of the final evaluation, and then all hope is lost. But you do need to have processes to kind of put the information together and learn. But the biggest challenge again is how do you do that if you're a project when you want to look at a local system? And yes, you overlap, but it's not the same thing. It's not the same indicators. It's not the same questions. And if you try to convince everybody among all your stakeholders that it's the same thing, you're going to shoehorn them into something that they'll be nice. They're getting something out of it. They understand you need to write a report. So they'll make sure it fits. But the problem of sustainability are real problems. They are real problems of power, of understanding, of technical fit, of resource allocation. And these problems need to be resolved. So if you don't get that systems dialogue to be honest and have an honest relationship with them about what your project is contributing or not, and too often we kind of, we try to make it all fit. It has to look nice. But just because it looks nice doesn't mean that it is true and meaningful. So So that's it. So, and one of the big thing, maybe I'm repeating the same thing over and over again, but what are we to the local system? So if you look at the local system as a network of institutions, of people, of cause and effects relationship, the money influence, the human resources influence, the quality of services, the quality of services affects the demand. I mean, it's all a network of influencers and stakeholders. When we come up with a project, we're kind of this huge elephant in the room. That's a big shock. We've broken an equilibrium state, and the system has to reconfigure. And since usually we come with money, the system is willing to reconfigure around us. But then at some point we're going to leave. And so in this process, we too often, in terms of designing and evaluating, we tend to remember the good old days when we had white coats and things happened in a petri dish and we were outside and things were happening in there. So we tend to think that we're outside and say, oh, we're going to ensure sustainability, this and that. The reality, we've been a huge disruption, hopefully for good, but not only for good. And I don't know why these slides move by themselves. So we need to become more real about that. And I think that's part of the future, is understanding that there are different roles being played and articulating more the dynamic of a project's role vis-a-vis a local system, and also the evaluation framework of the project and the evaluation framework of whoever is building some vision for sustaining the public good. And that's a big issue, and that's a boundary issue. I don't think we've resolved that. And to me, that's probably an issue that is very similar to what you're dealing with Scale Up. So I won't spend time on this. This was how we'd articulated some of the big pictures to look at when we were focusing on child survival. And basically, it just reinforces that it's multidimensional. And we'd spend a lot of time, and these were the dimensions that made sense. You can go back to the slides with all these different factors. It really depends in context how you define it. There'll be issues of capacity. There'll be issues of financial flows. The big process around that keeps it together. The outcomes are part of the determinant of the outcomes. And if we realize that scale up and systems are underlined by systems behaviors and rules, then we're dealing more with systems dynamics than input, output, outcome. We're dealing with the dynamics of systems and an equilibrium. And there's evidence for that, but the outcomes are one of the major determinants of the outcomes. It's very important to understand that. Your outcome is part of your inputs for the next phase. And even that, Tom Bossert in 1990 showed us, and he's done a repeat of his study, that the perception of outcomes is part of what helps the sustainability of the outcomes. So we can talk more about that. My kind of summary slide of things that, if you deal in a context, you're called in a specific context, a context of problems, or a context of countries, or a context of regions in a countries. What are the ingredients? Since everybody's trying to identify the top 10 indicators and the factors, I think, to me, you're creating chances for sustainability if you have some of these things here. One, you need to have processes, not just technical processes, but processes of sense making. And it's true if you're leading complex change in your organization. Our organizations are forever reinventing themselves, right? I mean, we have and we have to make sense of it, otherwise it doesn't work. We can't go to somebody and say, the indicator is 42, your department is being closed, have a good day, and expect that it's going to work. We don't do that to ourselves. Why would it work in a complex health system? So I think there's a huge part of accountability and learnings that builds into it, and I think it's interesting that social accountability is making a comeback. One of the recent papers that I quoted, no, I meant the Mali work that I didn't speak about, some of our Mali work currently with SAFE. There's even element of legal accountability that are playing a part into sustainability. Another element, another variables. So which ones are going to play out? The people, the diversity and agency of the people you put in there in your model. And these people, you want it to grow. The boundaries of the system are going to have to change and evolve, right? As long as, healthcare is just the benefit of these people, it's going to work at this scale. If you move to another scale, other stakeholders are going to be in. We're doing case studies of systems effects of ICCM, and we see that there was strong alignment, total buy-in from the central government. That was, no, I won't name the country, we're doing 5 and I'm confusing them, but there was strong buy-in, strong alignment to the government, ownership, hallelujah. But there was strong dissension between the central and the decentralized levels. And so the boundaries of the system that determine the sustainability have to evolve as people buy in. They say, okay, I'm interested in this, but see, my problem is, and then the nature of the problem changes. So that's part of it, is who are the people that you put around. And then with that, you do need metrics and honest signals. And if you are focused on outcomes, on benefits, that's the beauty of us as health technicians, is that we tend to have good metrics. You know, we know some things about what are good health outcomes in a way that's reliably measurable. And that's a strength. If we limit our worldview to that, I think we're fools. But if we ignore that, we're also fools. We have strong metrics. Many other sectors envy us for that. And if we translate them, if we're in dialogue with, you know, community members and everything, these metrics make sense, not just a number we throw out, but it can make sense. So that's a strong piece. So we can have very strong metrics. There's also elements that are going to be a lot harder to measure. And yet they are immensely important, especially to the stakeholders who determine the future. And that's the sense making. And so some variables are going to be very quantitative, very strong. Some variables are going to be messy. And you're going to have to define the dimensions in your context for your issues. I emphasize honest signals to try to correct our development assistance disease of, I'm still trying to find polite ways of saying it, but we do BS a lot. So we need to kind of get better at sending honest signals about sustainability. And evidence to action, are you the guys who kind of claimed loudly last week that you had failed at some project and closed it? No? Anyways, there was a paper on DevEx circulating, and everybody was talking about it, and that was brilliant. So that's what we need to have. All right, I'll skip the last slide. It's just repeating some of what I've already said, so I don't want to bother you. The last sentence maybe is that you're not going to have evaluation of system changes. You're not going to have evaluation of sustainability. What you're going to have to do, you're going to have to bring evaluation for sustainability. The act of evaluating is helping make sense and determine to move forward. Yes, we're going to have to balance some objective measures, some technical measures. It's not all soft and drawing diagrams and flip charts, but both are going to have a role. At some level of problem, the subjectivity enters, and we need to kind of get better at living with that. The last slide in the additional material kind of suggests a way from a paper to kind of start breaking down relative levels of complexity that we should take into account. So I hope I wasn't rambling too much. We have time for a question. I'm 2 minutes over, so thank you very much.
Okay, apparently I was told by Laura that I'm moderating the discussion too. So we have time for questions and answers then. So yeah, let me just...
Good morning. Fabio Castaño from Pathfinder. Thank you for your presentation. In an article that you wrote about Nepal and district-focused sustainability, you used the framework and it was brilliant. So can you tell more about how to work with local systems with this framework, especially in terms of universal health coverage, and we are moving into more countries implementing different mechanisms, and decentralization is becoming a very important issue in many countries. So it's creating problems, also opportunities. So how can this framework really help in that kind of dialogue?
We're taking questions one by one, or?
How would you like to do it?
Oh.
I think it would probably be good to, I frankly prefer one-to-one because sometimes I think questions get forgotten, but if you would rather do it.
Okay, so thank you for the question. And so, I mean, again, all models are bad, some are useful. I think we had a framework that proved useful, and then Nepal was another example. Uh, Later on, we came up with talking a lot about sense making, but I think sense making is fundamental to how we humans make sense of things. We create little storylines, we create little narratives that help us put the pieces together. So I think a multi-dimensional framework like this, you want to try to get some pieces right, but you could skin them in different ways, right? I mean, there's different ways. Even if yesterday I looked at the new health system assessment that that our colleagues at APT have put together, and they're kind of taking a step away from the building blocks, you know. So you can have different blocks to conceptualize what you're doing, but I think what was important in the Nepal example. And I know Steve Hodgins is on the phone, so I tremble as I say that. But we did spend some time, not a lot, but we did spend some time, and Jim was involved in talking with this district level, or whatever they're called in Nepal, and trying to create a bit of a story of what is going to happen, you know, in the future, you know. So there's this piece of dialogue. And then there was a mixture of kind of, okay, this capacity is important. You can talk about capacity in a way that's very understandable, and then you can go into some nitty-gritty of measurements that are quite, you know, difficult. So you need to balance the technical with the human, because you're connecting different pieces. I mean, in a context like Nepal, you had female community health volunteers, you had decentralization, you had these things. So I think it's part of having a process where you're going to work with people, you're going to bring your technicity, and you're going to try to come with something that's good enough. I think to me that's the issue. You need something that's good enough. You don't need something that's perfect. You need something that's good enough to get started. We only did this experience in Nepal once. I'm convinced that if we'd done it 2 or 3 years later with some follow-up and some ongoing discussion about it, the model would have changed. People would have said, well, this is not so important anymore. We need to look at that. Actually, when we're looking at capacity to transition to country ownership with CDC PEPFAR in Mozambique, in the provinces where nobody cared what we were doing, we were extremely reliable. We could measure the same thing over and over again because nobody cared. There was one province that took it seriously, and then by the time we wanted to repeat the exercise, they said, oh, you know what? We were trying to measure that, but that's really not that important. What we really need to measure is that. So the fact that you're going on a path of change, you're going to adapt your model. So you want to be good enough to make it to the next adaptation stage, if you want. So, and we wrote this manual with Jim and others about Jennifer Jurkovic, etc., on how to try to implement it. But you always going to have to fit it in where you are. I think evaluation times are great times to kind of take this time of thinking, and so midterm evaluation can be a great time to kind of, you know, if you can do it at design, that's great. But midterm evaluation, sometimes at the one time you get a chance to introduce that.
Okay, great. Here, Johannes, you had a question?
Thank you. Just very quickly, thank you very much for a wonderful presentation. I look forward to reading more about your work. I have a couple of observations. First of all, I think your first slide with that 2x2 slide, to me, is really critical, and it's really all about sustainable impact at scale. And so, you know, I remember Larry Cooley's phrase that sustainability and scaling, or sustainment and scaling, was sort of separated at birth, and they really shouldn't be. And so I'm just pushing you a bit more on that, since you're all, in the end, you're talking about sustainability is your theme. But actually, as I listen to you, it really is all about sustainable impact at scale. And then you link it to systems change. And so my question to you here is on systems change. Can you talk a bit more about what you mean by systems? You had that one graph where you very briefly touched it. But if it's really all about systems change, maybe we've got to dig a bit deeper and then link back to the concepts of sustainability and scaling. I haven't seen anybody do that. So if you have any guidance on that, would be helpful. A couple more quick comments on your slide where you had the 4 steps that starts with implementation on the left. I sort of wonder whether there isn't a missing step before implementation, which is design. Don't we need to design for sustained impact at scale? And so I love you to put that in there and sort of figure out, so what's the link between that and implementation, evaluation, and so on? Because if you don't design for impact at scale, what are you going to evaluate? And finally, sustainability, in my mind, also raises a question about at what stage do we actually not want to sustain something we've created because there's a new technology or there's a new problem that's occurred. It's actually more important than the problem we've been solving before. So is there something that we have to build into our analysis and thinking about sustainability that we're also willing to say there's a time when sustaining an intervention actually isn't a good idea because something has come up that actually makes that intervention no longer relevant or the most important, and we really have to change focus. So somewhere or other that would be maybe at the very end, just remind ourselves that sustainability isn't always, or sustainment isn't always the right strategy. Thank you.
Thank you. Very good point. So I'll start with the last one. Sustainability is not an inherent good. Actually, especially if you think of things staying the same or enduring, there's this whole thing called the theory of evolution that seems to say that things need to change. So we need to be sustained. We need to be good enough until the next adaptation stage. And then we need to be in a situation to be able to say, we need to change something. So there's this great little paper, great bathroom reading that Steve Hodgins made me read that's called Who Moved My Cheese? And I think it's probably very valuable to what we're doing. But I think that's the thing is if you focus on the outcomes, probably there's fewer chances that, maybe tomorrow there'll be some radical technology and we don't need to immunize people. Maybe. But right now, I'm not seeing it on the horizon. But until then, having full immunization coverage is probably a public good we can agree on. Not everybody agrees on it, but largely. And so if you focus on that, and if you get this system of actors, this expanding system of actors and relationships to kind of focus on that, and they say we need to do that. And you have this regular reference to metric, to common, not just metrics, but common values, there's a chance that by the time that a particular mechanism needs to end or needs to be abolished, you'll have a smarter audience to think about it, say, we've had that forever, maybe we don't need it anymore. I mean, you can be in France and say, we give money to people for having children, should we keep doing that for people that make more than $250,000 a year? I mean, France is slowly evolving by the 22nd century to address this question. For Americans, there's other questions. For Uganda, there are other questions. So yes, something. ICCM. Right now, I'm a big proponent of ICCM, Integrated Community Case Management of Childhood Illnesses. I think it's a great innovation that's been brought across in the last 25 years, and we need to sustain it. Do I believe that we'll have ICCM in 20 years in all African countries and Asia? And no. But right now, we have this huge gap with access to services. We need to do it. But if we focus on sustaining it in a way that asks questions about the future, maybe 20 years from now, when all the CHWs, they'll have evolved. Maybe some of them will have become health post nurses. Some of them will become social workers. So we can start thinking about the future. We need to continually adapt. So I think you're totally right. On the 4 steps, the little graphic, point well taken. I think it's mostly a caricature to try to make a point. On the 2x2 and system thinking, this whole thing about sustainability, I got into, and I do get nerdy a little bit about it. That's what led me to become quite geeky about systems and complexity. And so that's why people like Jim makes fun of me. But so this year, we've put some papers together out with people, and there's a whole lot of people in health that are trying to address system thinking, the WHO Alliance for Policy and Systems Research, the group of David Peters at Hopkins, Jim Thomas at Measure Evaluation, who's brought in a lot more network analysis and understanding of complexity. And so I kind of feel like I navigate these waters, and since I've got a big mouth, I pass sometimes for an expert. I don't think I'm an expert, but I think that's very much the way I'm starting to look at things more and more. And as said the children, as we try to say, as an agency, if we're getting serious about system strengthening, how are we going to take that on? That's very much the approach we've had, is to think about systems. And what are some, and it's fuzzy, it's kind of, everything is system thinking, but do we have tangible levers that help us know that we're doing a little bit better at system thinking? Yes, there are some tools, methods, but any method and tool, a log frame can be a great system thinking tool, and a log frame can be an extremely reductionist linear planning system. It all depends on the user. So my cheat sheet in my back pocket, I've taken from Martin Reynolds in the UK and Bob Williams in New Zealand. When I try to say, am I at least trying to think about systems, I try to think about the boundaries of the system, the relationships, and the perspectives I'm putting in the mix. In our health system strategy, we've added context as the starting basis. But if you're starting to think about the boundaries of your system, you realize that your project is not the whole world. There are boundaries. Even within your project, there are sub-boundaries. You start thinking about boundaries. You start thinking about relationship. You start thinking about the perspectives this brings into the picture. And then you can go through another round of that. You're probably doing more system thinking than you were when you are your input, output, outcomes, as useful as it can be. So I don't know, that could be a big topic.
Great, thanks. I think we want to try to take one or two questions from people who are online, and then we'll come back to folks in the room here.
Yeah, I'll just read them. So a couple questions, a couple comments. First, Eric, you mentioned at the beginning a resource or event where people could hear more on this topic. What was that? That's from Kristen Kruger.
So the USAID held an evaluation summit, I think in September. And so I got to speak about evaluation of sustainability. And I'm going back to USAID next week to redo the presentation. There was an encore. That's the first time in my life. So
Cool.
I'll dress up for that. But I do believe it's going to be recorded. So I don't know the details, but self-promotion being what it is, I'll probably put it on my blog, which I put on the slides.
Okay, awesome. Jose has a comment for you. He says you're raising some interesting problems regarding sustainability and dynamism. It can be very nuanced dance. It kind of relates to what Johan was saying just recently.
Okay, thank you.
Claire Cole has a question, but she's typing it, so we might have to come back.
Let's come back to the room.
Oh, can you guys hear me? Oh,
we can hear you, Claire.
Thanks, Claire. Yay! I was trying not to interrupt you and be rude. It's so hard remotely. Eric, hi, thank you so much. I wanted to ask you about, you said a lot of things, but one of your points was sort of this, if I'm understanding you right, implementation science and David Chambers' work and complex systems and our scale-up discussions and even adaptive management. We're all kind of sniffing around the same fire hydrant in some ways. And if we think about, I think you had a slide where you were talking about the transition from when the intervention ends and the eventual learning and adaptation. I think the way that you staged out the slide was that the learning and adaptation kind of comes after the intervention ends, but I know in the ExpandNet model, there should be a transition period at least, and sort of a capacity development of the eventual owners of an intervention as part of sustainability planning. So related to that, my question is, I presuppose that if sustainability depends in part on adaptation, then the capacity for adaptation needs to sit not just with ourselves, which we, in the room or virtual room need to build, but also with our government partners who would be the ultimate sustainers of the intervention. And of course, adaptation at multiple levels of the health system is a complex thing itself. So I wonder if you've seen anyone doing that well, or if you think there are frameworks. I imagine that the Sustainability Index that you propose could be a helpful measure for governments to track their own sort of success at adapting and sustaining dynamic change. But anyway, I just thought I'd ask if you care to talk about that. Thank you.
Okay, thank you. So first, yes, it has to start from the beginning. That wasn't the purpose of that slide to say it should be afterwards. The point of the slide was to say afterwards that the only thing that's going to remain, by definition, after the end of the project, there is no project. And so after the end of the project, it's what the local stakeholders are going to do that's going to matter. Now, remember that for us, since I love metaphors with physics, for us, our project is a little particle. We're like a little photon of light, and we come in an environment and we cross the room, and there's the beginning of the project over there, and we cross the room, and we have a mid phase, and we get to the end of the room, and then we're out. We're a particle. For the stakeholders who live in the room, we're just one in a big wave of light that keeps flowing through. So we think we're very special, as all teenagers do, but everybody is special. So let's remember that, because it does affect the perspective of the local stakeholders and their behaviors to us. So yes, it's a local adaptation from the start. It's just that there's going to be this period where we come and we bring change as a project, and we have our own mandate. I mean, no donor is going to give money and say, do good for the local system and have them measure what they need and be sustained and send us a report in 5 years. Nobody's going to give money in that condition. So we have direct responsibility for this system. Here's my boundary, the project, as much as we may be encouraged to engage with the stakeholders. And so finding this, shift in boundaries, how do we do that? I would claim that that's what we tried to do with the sustainability framework. And I think some of our publications showed how it worked. And then Ailing Walsh in the additional resources shows a way to use it. I think the recent paper from the colleague at the Health Metrics Institute that uses the David Chambers model is another way. It tends to be more research. And I try to speak today not just about research, but implementation and learning as we go. And so I think operationalizing the David Chambers model in that way, I suspect would end up looking a little bit like what you guys have done, but maybe it would change a little bit too. And I think that's what we try to do with the sustainability framework. That's why we describe these steps. If you look at the slide, I went rapidly over with these 6 steps. Those describe our best understanding at the time of how we would create the space for considering the need for local adaptation with a view of sustainability of the local system. So that's our theory of change, if you want.
I think we had another question here, and then we'll maybe switch back to the other side.
Thanks. This is nice to revisit some of these common themes that others have said. I'm new to the Sustainment Index concept, but have been trying to quickly check out that article. I'd be curious to know, most projects rarely have the gift of time and resources to do that retrospective sustainment review. I was seeing that you've been using DHS to look at population health and maybe service delivery outcomes as part of the index. So I'm curious to know, from a very practical perspective, how can projects and implementing partners and donors use the Sustainment Index to inform design, as Johannes was mentioning, given the externalities and complex factors that do inform sustainability or sustainment, who should be using this? I'd love you to hear you speak just a bit more on practically what can the Sustainment Index tell us, and what can we use from it?
Okay, so thank you. So I don't want to I know that we have some USAID colleagues, I don't want to put anybody at ease, but, we're always in the business of trying to get your money, right? So, with that premise, I think, so first, if in the additional material, you'll have some materials from Valuing Voices, and they've looked at case studies of post-project evaluation, ex-post evaluations, and I wrote back to Jindra and I said, hey, if you have outcomes that were measured, which is not always the case, would you apply this? The paper by Al-Bashrawi from the Health Metrics Institute, I think they have health outcomes, and he's looking at the paper and actually found a mistake in it. So they're trying to look at it. I think anybody who's actually had 3 point of time measures in health outcomes can start using it. It's just a metric, so I don't think it can guide how you're going to do it, but it can guide some research hypothesis or evaluation research hypothesis. And I believe that if we started saying, okay, I've got my funding until here, but I'm such a project that I do expect to be contributing to sustainability, and I'm getting to the end of my project, and we don't know how the Sustainment Index is going to perform, right? And I don't want to get into it now, but the DHS was just used to show that the metric could vary, but it meant nothing. There's no value. The example in it about the Concern Bangladesh paper is much more interesting, because that's based on sustainability work and study. But I think if we get better at saying, listen, we believe we're going to improve these outcomes. And because we're doing X, Y, and Z, because we have a theory of change, we believe that this local adaptation, this system getting smarter about itself and being able to adapt after the project, we believe it's going to work out. And we make a prognosis. We have a hypothesis that 2 years after our project, on these 5 indicators, we will have a sustainment index of X. And you can make it up, because nobody has measured it systematically. The index is here. There's no baseline. You're creating the baseline. So you can say, our hypothesis is that we'll have a sustainment of 1.37. Sounds scientific. If enough of us do that, and we do measure during the project, at some point, some donor is going to say, well, what about if we tested that? And I think there's a lot of appetite. I mean, we're in DC, so at USAID, but DFID, other places, Gates, in saying, okay, let's do that. And I think USAID PPL channeled some funds or worked with the education sector to do that some years ago. There wasn't a sustainment index then, but I think the paper just out, so I think we can make it happen. We can put hypotheses on the table and then go to our donors and say, don't you want to prove that I was right or wrong? And if enough of us do it, then we'll start to have a distribution of the sustainment index and say, you know what? We don't drop to 0 all the time, but we don't always get to 2. The sustainment index largely varies between 0 and 2. And, and maybe 1. But here, look at this indicator. We tend to be at 130. This one, that's the beginning of the use of a metric to learn as a global community.
So I'm going to take a question right here. And then maybe we could take one more after that. I think we'll probably have time for that.
I was aggressive in my question. First of all, thank you. Thank you for the presentation, and thank you for your seat. I really enjoyed it. And Laura, maybe if you have some particular references or resources that you would recommend, that would be really helpful, I think, to share. My question is, when I hear talk of sustainability, it typically is focused on health infrastructure services, organization of services, particular products, that kind of thing. I work in family planning, and there's a growing, I think, understanding and emphasis on social norms. Mm-hmm. And how we affect more normative change. And I just wonder, from your perspective, do we then measure sustainability, think about sustainability in a different way than we would? It seems to me we would, but I would love to hear your thoughts.
So again, I think I'm not sure I'm going to have a satisfying answer, but what you're pointing to is the issue that sustainability is too broad a topic. It's like the pursuit of happiness, we need to drill it down to next Friday night or something. So services, like 20 years ago or whenever it was that, I started all this work, there was actually, we called it our work the Sustainability Initiative. There was a family planning sector for sustainability initiative that focused on services. And they showed that they could really improve the sustainability of family planning services. One of the outcomes is that they tended to serve more the middle class than the poor. So the definition of the boundary of your system and what's the end outcome matters a lot. And that was very influential in pushing me to say, let's focus on the outcomes. Now, sustainability question can be asked at different levels. So now you're talking about social norms. So you're talking about social processes, relation, women to their husband, to their mother-in-law, to their neighbors and everything. So you're starting to define a very different problem than, say, somebody who says, we want to sustain a referral network for EMOC. Very different problems. So you need to be in that context, in that definition of the system. That's why it sounds, the USAID local system strategy is, we kind of became a mutual admiration society because I love their paper, and it turns out they love my paper, our papers. But they really spend a lot of time saying, you need to map the system. You need to map the system. And the reason is because the nature of the problem is going to lead to very different questions. So I think some of what I presented would apply, but largely I was looking at, when we developed all this, primary healthcare, community-based interventions. And so some of this is going to echo what you're trying to do in family planning, but here you're trying to look at very social. So you're going into a subsystem. You're drawing a different boundary around the question you want to look at. But there was some effort to translate the sustainability framework into family planning. I think the CEDARS page that ICF still maintains has, I'm not sure I gave it here. Yes, cedarscenter.org. That's my old shop. The website is falling apart, but just little piece by little piece, so there's still things hanging on. And there's a great resource page with a great, it looks ugly, but it's got a great search feature. So you can look for family planning and some suggestion around that. I'm not sure how much social norms it has in there, but definitely valuable.
Eric, thank you for this very, very exciting conversation. I have a simple question. You mentioned a word that I like very much, but you didn't say very much about it, and it's resilience. Would you say a little more about that, please?
So there's a lot of talk, there's great publications, there's a lot of interest in resilience right now, right? And I think some of it has to do with the Ebola crisis, where everything collapsed. And so I say things sometimes that I have to regret because I've got a big mouth. But I do think that as a global culture, we're a bit faddish with language. We tend to jump to language. So at the time that Ebola happened, and now we're talking a lot about humanitarian to development nexus, I think we're asking a lot of questions, which in my simple minds were sustainability questions. But when people looked at it, they said, no, sustainability is this static thing, but what we're dealing is a world that faces crisis, that faces shocks. And resilience is this whole idea that you can withstand a shock, that you will face a shock, so things won't be the same, and you'll somehow recover, that you'll have capacity to recover. So you can look at it as family dynamics. If you're into psychology, you can look at it at institutions. You can look at it as a national society facing. So to me, since I like to simplify things, to me, resilience is a bit sustainability when you understand that stuff will happen in the world and not all of it is good. So that's why there was a question about being adaptive, I think is also part of that, because if you expect that nothing bad will happen, you probably don't build very resilient system. You don't, but to me, the way I look at it is the transition from designing projects to designing sustainable projects as I understand it to be. I'm not sure I see a difference with what you would do in designing a resilient system. I mean, the trajectory we need to take as a project, our behaviors that we need to change in our design, in our implementation, and evaluation, to me are fairly similar. Now, there's a difference between sustainability and resilience with this concept of shock, but it all depends on how you conceptualize the world you're going to face with. But right now, there's really a lot of language about resilience, and sustainability has faded a bit in the background. So I don't mind adapting it, but there's a lot of similarities if you get down to the nitty-gritty and asking, what do you mean? So that's my best answer.
Well, I know people will have a lot more questions. This is a really huge topic, and Eric's a great resource, but I think we only have time for one more, which we'll take from online.
Melanie has a question, and Amanda is seconding this. Are there specific countries which have been able to successfully use the sustainability assessment to transition interventions beyond the life of the project? And it's twofold. When would be ideal time to begin this process in the life of the project?
So I'll start by the last question. When is the ideal time to start? Depending on your definition of evidence, I believe that there's humongous evidence that you need to start as soon as possible. Now, there's never going to be a randomized controlled trial of, let's start planning for sustainability from the start versus let's start planning from sustainability at 3.5 years. Nobody's going to randomize that. Yet everyone who has ever written about sustainability has always ended with, it should be planned from the start. So maybe they're just copying each other, or maybe they're all tapping into the same phenomenon. The same phenomenon they're tapping into, if I go back to my idea that there are laws under what we behave, systemic laws. If you look at systems and systems behaviors and complexity, there's something called path dependence. And path dependence, that once you've made a choice in a complex system, you can't just reverse. There's a huge energy cost to reversing, and sometimes that energy cost is such that you won't go back. So Big Bang, boom, 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 we have iron, we have planets, we're not going to go back. It's going to go forward. Biology, evolution, path dependent. Social systems. Once you've had a revolution, you've had a revolution. Let's get more pragmatic about health. Egypt, let's pay our community health workers and make them functionaries paid the minimal wage. Now you have 14,000 people paid minimal wage every month. They were volunteers, now they're paid. Imagine the price you would have to pay to try to go back. So we are path dependent in the behavior of our complex systems. If you behave that health systems are partly, purposive system. We design health system. We're going to build a clinic here. We're going to train some health workers. We're going to have some community health workers. Those are things we design, we engineer. They're a little bit like a car, right? We're going to have a lab here. We're going to have power and energy. Those are things we design. So we tend to think of a health system from this mechanistic point of view, which is not entirely wrong, but it is partially wrong. Because health systems are also made of many different people with different agendas. So they're also kind of complex adaptive systems. It's not either or. It's both at the same time. And so, and we see, look at France trying to move away from dependency on diesel fuel, which was a stupid decision made 25 years ago. And now trying to say, we've got the Paris Agreement, let's try to raise the tax on fuel so we use less of it. And now you have people in the street. It's not going to happen. So you can say, we can be mechanistic about it, let's raise the tax. But then all of a sudden you have a very complex adaptive response, which is people torching your city. So, and in healthcare it happens. We have nurses strikes, we have all these phenomena. We have people that pretend to work and don't work. All these things happen. So health systems are both a little bit mechanistic. We need ambulances with stars and they're also complex adaptive. For this reason, you need to start as early as possible. Your first question was whether there's a country that's used that at scale. To me, that's a question I have with my colleagues from Mali who are doing a great job in nutrition and a primary healthcare project in nutrition, is we're looking at what they've done and they're doing a lot of these things, which to me is like, oh, you're applying this principle from the sustainability framework, you're doing this and do that. They've never read my stuff. Like you guys are making me fabulous. Nobody talks to me at SAVE except, colleague. No, I joke. But people do it sometimes tacitly, implicitly. That's part of the magic. Why do people love leadership? Because leadership, it's intangible. But when it happens, all of a sudden, some things work. So, I mentioned the ICCM in Rwanda. Well, the Rwanda Ministry of Health never sat down, looked at my graphs and say, oh, we need to do this, we need to do that. They sat down and they said, we're in charge here. And that's what we want. We have a vision. They didn't say, let's call Sarriot to have a vision statement about sustainability. They just did it without asking me. So, that's a big question. Are you better doing things that respect these principles tacitly, or do you need to do it strategically? The posit that I would make is that in our development projects, because we are projects and because of the nature of who we are in these systems, and the disruptions we create, some of them are unwanted, we would do better to be strategic about it. Just like I think your model, ExpandNet, you speak about a spontaneous scale-up. You don't say everybody needs us to scale up. But you say, hey, we're in this world where we're trying to do all these big things in health, and we need to get better at doing it. So we created a framework. But people will scale stuff up without asking you either. And they will sustain stuff without asking. So I don't think there's a country that has taken this, but there's certainly countries that have taken on some of the principles. And maybe we just borrowed their principles to put them into our model. That's actually how we created the model, based on practical experiences of implementers. So,
okay, I guess we'll have to leave it there then, right? So,
yeah, we should wrap it up. Thank you, Jim.
Okay.
Thank you, Eric.
Thank you very
Thank you,
much.
everybody.